Good evening. My name is Claire Saxton with the Cancer Support Community. Welcome to our webinar, Frankly Speaking About Cancer, Making Treatment Decisions, hosted by the Cancer Support Community. If you need technical assistance during this webinar, please dial 1-866-229-3239, option 1 for help. Before we start, I'll go over some reminders and housekeeping items. If you would like to listen to today's presentation via telephone, please dial in using the conference line code you see on the screen. Today's call is being recorded and will be available on our website at www.cancersupportcommunity.org/webinars within the next week. The format of today's webinar will be as follows. The panelists will begin the discussion first, and then we will open the discussion up to the audience during the question and answer session. Thank you to those who submitted questions prior to the webinar as part of the registration form. If you would like to ask additional questions, please feel free to type it into the Q&A box on the right of your screen. You may submit a question at any time during the event. At the end of this webinar, you will be automatically redirected to the post-webinar survey. Please take a few minutes to complete this survey, as your input is of great value to us. I would now like to introduce the Cancer Support Community, which is the largest professionally led nonprofit network of cancer support worldwide. CSC is dedicated to ensuring that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We offer the highest quality social and emotional support through our affiliate network, as well as online or over the phone. On this screen, you'll see some of the resources we provide at the Cancer Support Community. The first one there is the Cancer Support Helpline, which is staffed by licensed professional counselors who are available to assist you Monday through Friday, 9 a.m. to 9 p.m. Eastern Time. We also have our Open to Options program, which is a research-proven program that can help you prepare a list of questions to share with your doctor. We also have our Frankly Speaking About Cancer program, which is CSC's landmark education series, which provides trusted information on a variety of topics important to people affected by cancer. I would also like to introduce our Cancer Experience Registry, which is a unique project for people affected by cancer. People who have been diagnosed with cancer and those who help care for them can join the registry. You begin by answering survey questions. Your answers and those of others describe the experience of cancer patients and caregivers. This information is used to provide education and support resources that speak to patients, caregivers, and their needs. For more information or to join, visit www.cancerexperienceregistry.org. I would also like to take a moment to talk about our grassroots movement, which helps ensure that people touched by cancer have access to quality, comprehensive cancer care that includes social and emotional support. Again, if you would like to learn more about this program or to sign up, visit our main website at www.cancersupportcommunity.org. I would now like to introduce our panelists, Justin Short and Carmen Paris-Hunter. Justin Short is a licensed clinical social worker and certified oncology social worker who specializes in counseling individuals and families dealing with cancer, chronic disease, and other health concerns. For nearly 4 years, Justin served as the program director at Cancer Support Community Montana. His work there increased his passion for providing psychosocial care to those dealing with cancer, chronic illness, and other coexisting conditions. Justin currently splits his time as the owner and sole practitioner of Ridgeline Counseling Services and as a telehealth counselor for Cancer Support Community's International Cancer Support Helpline. In addition to healthcare counseling, Justin has practical experience and knowledge in many public health matters, including maternal and child health, policy, prevention, and health behavior and education. Our lung cancer survivor, Carmen Paris-Hunter, is the director of the Center for Neuromuscular Therapy and Related Health Services, Yoga and Meditation, in Somerset, New Jersey. She is a national certified healthcare educator, facilitator, and mentor. Practicing in private practice as a soft tissue specialist, craniosacral therapist, and medical massage therapist, health educator, and teacher, practicing and teaching yoga and meditation for over 30 years. She opened the center in 1994, where she continues to offer classes and workshops related to health, strength training, yoga, and meditation. Carmen Paris-Hunter often serves as consultant to the medical profession and is nationally acclaimed for her work with challenging illnesses, including her own journey and survival with lung cancer. I'm now going to ask Justin Short to share with us his tips for making the best treatment decisions.
Great. Thank you, Claire. I appreciate that. I'm really happy to be a part of today's webinar. As Claire said in the introduction, I am a helpline counselor with Cancer Support Community's Cancer Support Helpline, and we are available to help anyone affected by cancer try to navigate the cancer journey, which is often very difficult. Some of the questions we often get are, how do I know if my treatment team is a good fit for me and if I can put all of my trust in them? And those are great questions. We actually get lots of calls on the helpline about that. One of the most beneficial parts of the Open Options program is that we actually are able to spend time working with callers trying to figure out what's important to them and what are their goals and what are their priorities and what do they want out of their cancer care. But even before we get to that level, many folks are just confused about their treatment team. Maybe they've never actually taken a tour of their local cancer center, or maybe they live in a really small city like in the state where I live in Montana and they have to drive 2 or 3 hours to and from treatment every day. And how do you know that the doctors and the PAs and the nurses and the social workers there are going to be able to care for you in the best way possible? And one of the things I'd like to highlight on this particular slide that says choosing your treatment team is about the cancer center. Yes, it's important to find a doctor that has a specialty in your particular type of cancer if that's available. So if you have a blood cancer, finding someone with a background in hematology and oncology is really important. If you have lung cancer, finding an oncologist that maybe did a residency in pulmonary health, that's important. And also, if radiation has been a course of treatment that someone has recommended, then finding a radiation oncologist as opposed to a medical oncologist might be the more important thing. So the first thing is just to get more comfortable with the terminology and to understand who the best fit for you would be. When it comes to the cancer center, the American College of Surgeons actually has a commission on cancer that accredits many cancer centers around the nation. And that's one of the highest levels of certification that a cancer center can have. And it ensures that there is opportunities to engage in psychosocial care, spiritual care, physical therapy and rehab, community outreach. They have screening and prevention programs and dietetics. So I would encourage anyone who is maybe trying to make a choice between one cancer center and another, it's a really good idea to go to the American College of Surgeons Commission on Cancer website and see if yours is listed. And if your healthcare plan allows you to choose, then I would say try to choose the one that has the highest level of accreditation. That's generally a really good idea. Choosing your treatment team, continuing on with the first slide, how to communicate with your team. It seems really basic. Communication should be pretty easy. I should be able to send my doctor an email or a phone call or maybe even text them, and surely they will get back to me in a reasonable amount of time. Sometimes that's not the case. Many different cancer teams have multiple layers of professionals involved. And I think a good question for an oncologist would be, so for routine questions I may have about an interaction with a drug I'm taking, or if I'm feeling overly nauseous and I've been, vomiting for 3 or 4 hours, are you the person that would like to take that call? Or is there someone else on the team that has been designated to handle those calls? Is that your nurse? Is that your physician's assistant? Or do I have your direct cell phone number? So sometimes just basically asking the question, how can I get in touch with you to let you know how I'm feeling, either pre-treatment or post-treatment, is a good conversation to have with your medical team. Many hospitals also have a patient portal. As more and more records are being put online and there's electronic health records involved in your care, there may be a way that you can engage in a portal and send a text message or involve yourself in a chat. And could be a quicker way to get answers to your questions or to have someone address some of the symptoms that you might be feeling at that time. What kind and stage is your cancer? This often can be very confusing to patients. It might be that in the initial meeting with your doctor, you hear lung cancer, and then you don't hear anything after that, which is actually very common for anyone sitting in a treatment room with an oncologist and have just received the news that they have cancer. We often tend to block out about 75% of everything that comes after that because we're in shock and anxiety takes over. But when the dust settles, and assuming you have someone there with you, which I will talk about in a little bit, it's important to understand the staging and maybe how fast-growing your cancer is, because that could potentially affect the treatment options. And I have been around a lot of oncologists in my life, in my professional life, and there really is no stupid question when it comes to asking them to spell out exactly what your cancer is, what the stage is, what technically is the diagnosis, and to maybe have them share with you any sort of, the results of a biopsies and give you a copy of the pathology report. I think the more educated that you can be about your cancer and the more empowered you can feel in your healthcare, the better across the board. Understanding your options. Again, a lot of folks who are ill and in the healthcare system, we go to our doctors and we say, Doc, just tell me what I need to do. Just fix me, make me feel better, and I will, I'll be as compliant as I possibly can. Well, sometimes in cancer care, it's not that easy. There might be multiple avenues you could take in terms of treatment. It might be that surgery is mentioned, chemotherapy, radiation, sometimes all three, and sometimes all three are done at different stages. And so it's really important to understand what the treatment that the doctor is recommending and to have them tell you why. How ultimately is this course of treatment going to hopefully lead to a higher quality of life? That's really what it's all about. Or to have your cancer go away and to be undetected so that you can continue to live a fruitful, productive life. And again, there are no stupid questions when it comes to asking your oncologist to spell out for you exactly what is going on in your body. Because at the end of the day, it's your body, and you are ultimately in control, although I know it often feels like you're not in a large medical system, but you're ultimately in control of what is happening to your body, and your medical team ultimately works for you. Now, I agree that it's actually a good idea if you have resources in your town or somewhere in your state where you can engage with other folks who maybe have been diagnosed with the same type of cancer. It can be a real emotional boost to be around some of those folks and to engage in a support group or to engage in a one-on-one kind of buddy or companion program. But sometimes the feedback that I get on the helpline is maybe a particular treatment has worked for someone that you're having coffee with. You guys have a similar cancer diagnosis, but that treatment's not working for you. And sometimes that can add an extra layer of anxiety, stress, and worry because it's worked so well for them. So cancer treatment, while it can be broadly sort of applied to certain populations, at the end of the day, it's a very individual experience. And not everyone reacts to the same cancer treatment the same way. Good questions to ask about your cancer treatment in general. And the reason we put in general there is that really our topic today is cancer and lung cancer, but for any sort of major medical diagnosis, these questions would apply. And there's too many questions for me to go through today, but it's amazing how many people call the helpline and have felt like they can't ask these questions, or that these questions were not answered proactively by their oncologist. And again, I know many oncologists, and I think every single one of them would say, yes, I absolutely intend to answer all 14 of these questions in my initial meeting with my patients. But sometimes the day gets away from me, and sometimes I feel like I might be creating more anxiety with my patient by talking about potential side effects, for example, on day one before treatment is even started. But these questions, if you could come back and copy and paste from these slides or find a way to capture these questions for yourselves, this is probably one of the most important slides out there. Is there a clinical trial option for me? Number 8, a lot of people overlook. The National Cancer Institute has a website where they list all current clinical trials that are going on for various cancers affecting various populations with different treatments that they're testing. It might be that a clinical trial is an option for you. That generally doesn't come up in a run-of-the-mill conversation with an oncologist, but it's a question that a lot of doctors really appreciate patients asking and being aware of. I also think, how long will the treatment last? How often will it be given? And what are the side effects of treatments, and how can I manage the side effects? The side effects piece, I think, comes up in the helpline as a topic. It's probably in the top 3. A lot of, again, I am not a physician. I'm a licensed clinical social work, and I have a certification in oncology social work. But being a part of the medical care system and having friends in that system and colleagues in that system, the side effects question sometimes is difficult for them to talk about because, again, they don't want to create undue stress and worry from the very beginning by telling you what all the side effects might be. But a lot of times in the helpline, we have people call and say, I really wish someone had told me that I might have lymphedema that lasts for a really long time, or a lot longer than I thought it would, or that I might have tingling sensation in my hands and feet, or be extra sensitive to hot or cold temperatures. And so that might point toward neuropathy, or that I might have a level of chronic pain that I just can't seem to shake. While it can be a little intimidating and, again, a little anxiety-producing to talk about those things in the beginning, I think it's really important from a patient empowerment perspective to get an idea about how you might feel from your treatment so that you can be proactive and try to find ways to mitigate the negative side effects if your treatment has those side effects as a possibility. And not all treatments do. Some treatments are relatively straightforward and there's minimal side effects, while others, especially if there's radiation, chemotherapy, and surgery, there might be a handful of side effects that you are expected to deal with. Good questions to ask about surgery. I think for me, on this particular slide, the issue that comes up the most on the helpline is recovery from surgery, and often immediate recovery from surgery and engaging in physical therapy. A lot of cancer centers will have oncology rehab as a part of their program, and it is often reimbursed by Medicare, Medicaid, and most major medical plans. Asking about a way to get involved in physical therapy as soon as possible after surgery is a very great topic to bring up with your oncologist or with your surgeon. A lot of times folks don't realize that engaging in physical therapy right after surgery can actually significantly reduce the lasting effects or the kind of long-term effects of having lost some muscle mass, feeling fatigue, and feeling maybe overall sort of hopeless that you're not getting the body back that you had before. And so, again, these are wonderful questions to ask. I think the length of recovery and maybe lining up friends and family or someone in your church community, if you're involved in a faith community, to be able to bring you meals or to just check in on you or to encourage you to go for a light walk is all very helpful. And so, again, there's never a stupid question when it comes to asking about the psychological effects of surgery, the physical effects, and the effects on the family as well. Continuing to make your treatment decisions. I know I sound like a broken record, but we do get a lot of people calling the helpline about issues that are in these slides. In the financial piece, bullet point number 1, ask to sit down with the financial or insurance counselor at your cancer center. We are getting more and more calls about the financial impact of cancer these days. Even with a really great healthcare plan, there's copays and there's money that you owe for prescription meds, and these things can really pile up, and they can pile up very quickly. And financial stress in a family can also create lots of fractures and divisions and stress. And again, trying to be proactive as much as you can by either, actually I'm going to retract that, not either, I'd like for folks to start doing both. Not only calling your health insurance company and asking what is covered and what is not, but also seeing if your cancer center has a financial case manager or an oncology social worker that might be able to explain to you in general the impact financially that this might have on your family and what to expect. Because if there's things you can expect, then you can plan for them. And again, this is all about empowering the patient to become more patient active so that there's less chances that things are gonna pop up all of a sudden and completely take you by surprise and leave you feeling a bit hopeless and depressed. Depression and anxiety often are followed by a cancer diagnosis. Tips for good decision making. Again, very valuable slide. I highly suggest that you copy and paste as much of this information as you can, or print out these slides and even take a couple of these slides with you to your medical appointment. One thing I didn't highlight on the former slide is actually something I engage in sometimes on a weekly basis, and that is officially the Open to Options program. The Open to Options program is a structured, intentional interview, for the lack of a better word. It's really more of a conversation, but it's a structured time where someone who's gone through the Open to Options program, and all of us on the helpline are certified to do this, will help take you through a series of questions and topics to think about so that we can really hone in on what's most important for you and your family and what you want from your medical care team. I think all of us have certain priorities and goals in life, but when we're diagnosed with cancer, we assume that we can no longer hang on to those priorities and goals. And actually, that's not the case. We might have limitations placed on top of us with what we can do in our life, but that doesn't mean that we can't still strive for them and that we shouldn't try our best to engage with our medical team about what's important to us. So the Open to Options program allows us time to help extract questions and concerns you may already have in your mind, but you just don't know how to put in words. And so our job is to help you put some of those things into words on a one-page document that you could then send to your oncologist or someone on your medical team in advance of your appointment so that they can be more prepared to answer your questions, which will all lead to a more productive, efficient meeting with them. And then it also gives you a peace of mind knowing that you're in the driver's seat and that you're a little bit more in control of what's going to happen through your cancer care. Okay, so back to tips for good decision making. This slide does summarize a lot of what I just said, and one of the things that I want to bring to your attention that I maybe have not mentioned before is the importance of taking somebody with you to your medical appointment. I referenced before that we often sort of get into a tunnel vision where we're not able to really pay attention to all the jargon, which there's enough medical jargon flying around left and right in a meeting with your oncologist. It's so easy to get confused. We don't know how to pronounce the words that maybe they just said, and we surely don't know how to spell them, and we definitely don't know what they mean sometimes. Having someone else with you to take some notes about what the doctor has said and what they're recommending is very, very important. And it might be that some folks don't have a support person to take with them. You can always ask that a staff member sit in with you, or that maybe there's a certain volunteer who has spent enough time at the cancer center that the cancer center trusts to be in the in the treatment room with you to actually help take some notes. So that is a possibility. Open to options. Again, this is a wonderful program that anyone on the helpline is able to engage with you. We often have folks call up and want to schedule a separate time to engage in open options, which we most certainly can do. The helpline is open 5 days a week, and if there is a particular day and a time that you want to sit down with a counselor over the phone and go through what some of your priorities and goals and concerns and worries are, we can most certainly do that. There's also folks available at local affiliates as well that you can call and ask at a local cancer support community affiliate if they've been trained in open options, and if they can set aside some time for you to go through this. We find that the reduction in anxiety and depressive thoughts is a major benefit of open options. I mean, anxiety in and of itself, again, I think makes it difficult for us to hear what's being said to us, and sometimes it's very difficult to process what's being said to us. And so open options, again, is a wonderful anxiety reduction process to go through, as well as a patient empowerment process. Understanding how your treatment options may affect your goals, I think, is probably one of the biggest benefits of the Open to Options program. Well, a couple of weeks ago, I was doing an Open to Options with a woman who came in. She was just diagnosed with cancer, but her daughter was getting married in Hawaii, I believe, and there was going to be lots of hiking and lots of beach activities, and just taking that long flight from the East Coast to Hawaii was going to be enough stress on her body. And we were working through the program together, and it became really clear that she wanted to delay starting her treatment until after her daughter's wedding. Now, some of you listening to this might think, well, wow, gosh, delaying your treatment, isn't that going to set you back medically? And I'm sure the doctors want you to start as soon as possible. For some of you, I think that that's probably the decision you would make, and that would be the right decision for you. For this woman, it was more important to be able to be with her daughter and her family on her wedding day and not have some physical limitations like fatigue and recovering from surgery and having gone right into chemotherapy, which again often leads to extreme fatigue. It was really important for her to delay her treatment. And we kind of went back and forth with what some of the pros and cons might be with that. But the most important piece was, at the end of the program, she felt more empowered to have that conversation with her physician, instead of just assuming that the doctor was going to somehow create that conversation with her and give her an opportunity to discuss the importance of it. So again, the Open to Options program, it's free. It's available to anyone that has a major medical appointment coming up. You can call the helpline and engage, or you can go to a local affiliate and see if someone there is trained in Open to Options. You can look for a local affiliate by going to cancersupportcommunity.org and clicking on the Find an Affiliate tab, and we have them listed based on the states. A lot of states have multiple cancer support communities, and so it's important to look at that, find the one that's closest to you. But if you don't have one in your town, again, the Cancer Support Helpline is free, and it's open to anyone affected by cancer. So that means people with cancer, but also support folks and family members. And you can reach us by calling 888-793-9355. And we're open 5 days a week right now from 9 to 9 Eastern Time. And again, I encourage anyone who feels like they may not have anywhere to turn or have any support available to them in that moment when they're feeling particularly anxious or depressed about their cancer experience, please give us a call. We would love to hear from you. So thank you very much. I appreciate the time.
Carmen Paris-Hunter, a lung cancer survivor, will now share her experience with making treatment decisions.
Good evening. I must say I'm thoroughly delighted to listen to Justin's very in-depth and detailed account of the journey. My cancer journey began with my own diagnosis in December 2012. But it really began in 1988 with my finding the father's tumor in his leg, which doctors kept saying, it's his back. And then with my younger sister being told for a year and a half that there was nothing wrong with her until they found a brain tumor that had metastasized from her lung. And that was 1998. And I was the caregiver for these family members. Being in the health field myself, I work with many people, and when I received a diagnosis, being a healthy, active person, teaching and strength training and yoga and my own physical workouts and working with people that have conditions, I was shocked that I had something wrong with my initial diagnosis of myself, going, oh, this is not normal. So I started my journey going to doctors. It started with my extreme fatigue. I am really extremely energized in my life and always have been, but this was not normal. And a slight, consistent, non-productive cough for over a month that became more aggressive with no mucus or fever. And then there was the lack of passion and desire, not just sexually, but no interest in daily life activities or creativity. No appetite for food, no libido, achy from head to toe. This is very, very unlike who I am. So I went and I started visiting doctors, my doctors that I have been seeing for yearly checkups, 4 doctor visits with the same outcome. You're fine. Look at you. You're thin, you can touch your toes, you're active, you have muscles, no testing, no advice. I started thinking, going back over my journey with other people that were ill and asking the same questions that Justin has had on his list, which were excellent. By the time I got to the 5th doctor, I asked for a CT scan. I did not want to know what he thought. I did not want any advice. I said I would like a CAT scan and blood work. And he goes, but I'm leaving for vacation. I said, have a wonderful time. Thank you. And with respect, and he gave me the prescription, and 4 days later, I discovered I had a large mass on my lower left lobe. So from there, I sat with my pulmonologist, shoulder to shoulder, looking at the slides. She looked at me and she said, The doctor said, what would you like to do? I was thinking I wanted to have the mass removed surgically. Immediately, I thought of my lungs like an apple. If you have a bad spot in the apple, you don't throw the whole apple away. You kind of take what's bad out and you keep the healthy part. Friends, family, and doctors all had their own opinions of what to do, but the final decision came down to me. So I went to meet the surgeon, and the surgeon also became my yoga student, and his family became my yoga students, and I had the mass removed February 25th, 2013. I was out of the hospital a day later. Normally, you're supposed to go to ICU, but because of my fitness, because I knew how to move my body kinesthetically, was comfortable with the pipes and the incisions, I said I need to go home. And so they released me, and I was back doing my regular life at a little slower pace, but in 2 weeks. I began chemotherapy. I decided on chemotherapy, having viewed the type of cancer, the staging, the type of cancer cell, and said, well, I had 3 nodes that escaped from the mass. I think I should use a little chemotherapy to exclude any other events. So the surgeons recommended chemotherapy as well. I have many friends that are scientists and that are in the health field, and they recommended a cancer research lung center for me. It's not who I wanted to go to. I knew an oncologist, but his group was Hematology Oncology, but I knew the group and I knew how well they work with all oncology situations. That's who I wanted to go to, but I trusted my friends and scientific view, and so I went to the Lung Cancer Research Center in New Jersey, near my home. I took someone with me to take notes and write down questions for the next visit, and I also took down notes and questions so that we checked our notes at the end of a visit. When I would go back for the visit, I felt very much discounted for, like, why are you asking these questions? You're the patient. So I had to be very firm, saying, yes, I am the patient, and I'm trying to have patience listening to you tell me what I should do with me not having a say. So it was very important for me to be very grounded and tell the doctor what I was thinking and have them hear, truly hear why I thought this should be. I also, after 2.5 weeks, decided to stop treatment there because I was on my hands and knees because, one, the doctor would not give me, I did ask for a phone number. She would not give me her contact number. She gave me her assistant, her nurse practitioner's number, and that's the only person I was allowed to talk to. The other condition was that I was severely constipated, which I had inquired about, and I was given a prescription for a drug. I went to the drugstore, and the prescription was $300 for a laxative. I almost passed out right there, but I said, no, thank you, and decided to put together my own treatment, which worked. I went to the first place, the oncologist that I wanted to go to, and I called, and they saw me immediately. The doctor came out, opened his arms, and said, we're going to take very good care of you. And that was when my healing began. Because they were human, they listened to my concerns and my input, my research. The new oncologist called the doctor that I had previously, and she was very angry. How did you get my number? And he said, I'm a doctor, I'm an oncologist. And he goes, why were you treating this patient with 40% more chemo than was needed for my body weight? So it's really important to know what you're being treated with, how much, and for how long. The oncologist at the first center said, came in the room, and she told me the treatment I was going to receive. Now, this is the importance, I want to emphasize, the importance of taking notes and having someone take notes with you. My notes and my companion's notes read exactly the same. The treatment that was prescribed was different than what the doctor was saying. I looked at the doctor and I said, no, that's not what I'm receiving. This is what you said. And she argued. Then she looked down at her chart and she said, excuse me a moment, I have the wrong chart. Most important to know what you're being treated with, for how long, and what the side effects will be. Alternative medicine. In addition to chemotherapy and surgery, I also maintained a balanced diet. When I was receiving chemotherapy, I looked around the room, in the chemo room, and noticed that people were eating cookies, candy. On the tables, people brought donuts. I would especially make myself a very substantial, small lunch that I would eat before chemotherapy. I'd really get ready for my chemotherapy. And then I looked around at the people, and I said, oh, this can't be. So I started bringing sandwiches into them also. And I felt this would fortify them. Now, I'm not a certified, well, I'm a certified nutritionist, but I'm not a master. I don't have a degree in nutrition, but I did well. I exercised daily, and I made sure I slept 9 to 10 hours a night. I practiced yoga and meditation. I helped other people going through the same conditions of cancer, many other health conditions, move in this direction to maintain your own health and to stay balanced. I went into remission after a year, 7 months on chemotherapy, and the remission was harder for me than having a challenge of fighting a cancer. The remission was the hardest because they say you're supposed to feel that you're in a safe zone until you're not. So I kept waiting for the other shoe to drop, as most people in remission do. It's hard to just say, okay, forget about it. No, you have to maintain and keep watching. So I kept watching, and every time I coughed, I would have a little fear. And one day the doctor said, Carmen, you're going to get sick like everybody else. You'll have a cough, you'll have a sneeze. And I settled down, but I still kept watching, still kept exercising, still kept laughing and living life, but with an eye toward make sure you're healthy. I was attending a class for people in remission at the same center that I started with that I left. And I was getting a very bad feeling while I was there. I thought I was getting triggered by the memory of what I went through. And I went home on the last night of the class, the night before the last night, and I said, something's not right. So I went back to the doctor, and I said, something's really not right. And in May, I found out that the cancer had returned, and small amount. It's too small to treat right now. In the oncology world, they say, if there's not enough meat, you can't treat, which is kind of funny. I thought, I laughed. I said, But the reality is, now what? And so the now what is to keep living balanced life. Now I'm researching alternative medicines and also still open to what can be done. For me, because I had surgery in the removal of 3/4 of my left lung, surgery is not an option. The cancer came back multicentric, but so small that there was nothing no one could do at the moment. So this is what I focus on, imagining myself working with these little tumors because the cancer cell is very weak, to eliminate them while I'm waiting to find the right treatment for myself. I will continue doing herbs as I've been doing and eating properly and looking and seeking good treatments. You are your own best advocate. For the next slides, noticing the quality of your health, taking care of yourself, noticing when you're not recuperating from a cold or a condition in a timely manner, and calling a physician to support your questions. Making a checklist, physical pain or discomfort, weight loss or gain. What is your mental state? Is it positive, negative, or detached? Emotions are very important to acknowledge and allow. If you're angry, acknowledge that you're angry, and then move past that. If you're sad, acknowledge it, or depressed, acknowledge it. If you don't acknowledge it, you go into denial and you push it away, and then you're not paying attention. Noticing the level of energy. If you're too tired to attend to your daily activities or too wired to sleep. Taking the time to sit down and just take a breath in and a breath out. And then calling in the medical team for a diagnosis. Report changes to your treating physician, asking questions, and if not satisfied with the response, to keep searching and seeking other opinions, such as radiation. An oncologist that specifically works with oncology and radiation, or chemotherapy, or herbal. The body remembers what the mind forgets. So the body will talk to you, and the mind will go, oh yeah, I remember. You bridge the gap between the medical and the holistic treatment to survive and thrive through illness and cancer. You are your own best advocate. Self-trust and self-compassion, following your gut feelings. getting in touch with your intuition and learning how to listen, how you are feeling, taking the time, alone time, to rest, relax, and renew. I like to say, breathe in all the good and exhale what no longer serves you. You breathe in all the good, exhale what no longer serves you. That means sadness, anger, ill feelings. From diagnosis, healing to remission and beyond, the challenges of illness, cancer, and treatment are many. But moving with strength and courage through fear and isolation and back to joy, as you move step by step, saying, yes, I am stronger, yes, I am healthier, yes, I can do this, saying, affirming, setting intentions right at the base of your spine, and let that, each breath will renew those intentions. They will renew. Every time you inhale, those intentions will blossom. They're affirming what you are: strong, healthy, happy, peaceful, balanced, or focused. And then you make your decisions, choosing right treatments. From these places you come to, you are unique, and what works for some or many may not be for you. So you sit and you breathe and you ask yourself, what would be best for me? Is it important for me to have someplace close, or can I travel 2-3 hours to go to a special clinic and back? What is good for you? Ask people to help. That was the hardest part of my journey for me, is to not only ask for help, but accept the help that was given to me. It was very humbling. I'm usually the caregiver. I'm usually the one that does it, gets through it. And I've been blessed by learning to be humble and to appreciate that we all work together. It's not just one person, but we work together as a team through illness and through health to continue on, to be all that we could be open to all the possibilities. I thank you.
Thank you, Carmen.
Thank you.
We would now like to open the discussion up to the audience. We may have answered some of your questions during the presentation. However, if you have any additional questions, please feel free to type them in to the Q&A box to the right of your screen. One moment, please, while we wait for questions. Our first question is for Justin. It's from a caregiver, someone who's caring for their brother. She asked, what is your best advice for caregivers when their loved one is facing a treatment decision?
Thank you. That's a great question. Number one advice for a caregiver, I think so often family members can unwittingly impose our agenda, our wishes, and maybe how we would want to move forward with treatment onto the ones that we love, because we do love them and because we are fearful of the worst case scenario, which is they die from their cancer and we don't want to lose them. And that often is at the base of some of our fear and some of our inability maybe to listen and to respect their wishes as much as possible. So I'd say the number one thing is to try to come to your loved one with an open mind and try to come with as less judgment as possible about what they're choosing to do. You can offer them opportunities to become more educated about their cancer diagnosis, and you can offer your services to be able to go with them to their oncologist and ask maybe some of the hard questions that they're not going to ask. But I think at the end of the day, respecting what their decision is with regard to the context of their life and what they want out of their life, and trying to suspend judgment and how you would make your own treatment decision is probably the best thing to do, and it's probably the hardest thing to do, to be honest with you. So that's what I would say for that question, and that was a great question. Thank you for asking that.
Carmen, as a lung cancer survivor, do you have a perspective you want to share on that question?
Yes, thank you. Family and friends mean well, and oftentimes, as Justin pointed out, the fear of losing the person you love is at the forefront, and from what they've read affects their opinion. But you have to really ask yourself, once again, go back to have the person truly ask themselves what they would like to do. Oftentimes, if the person is elderly, they don't know what to do, and so you can seek the advice of the doctors and the nurses. Nurses are wonderful to give information, social workers, calling hotlines, but to continue honoring what the person wishes, but at the same time help them find answers so that they could make their best informed decision. I hope that helped. So I know my family, they wanted me to do many, many different things, and because they know I was so organic or so healthy, they said, why are you choosing chemo? Why aren't you using herbs? And I said, because this felt right for me, from everything I've studied, from the type of cell. You have to know a lot about your condition to make the most informed decision, and to realize everybody means well, but in the end, it's really up to the person who is going through the treatment.
Thanks, Carmen.
Thank you.
And one more question that we have, and I'll again pose it to Justin first, is about quality of life. There have been some recent news stories about how oncologists don't always choose to treat themselves with the same aggressive treatments that they offer their patients. How do you talk to your doctors and get a good sense of what is your life going to be like after this treatment, and how do you make, if you're looking at treatment, how do you make a decision based on quality of life, not knowing what it's going to be like before you get there?
Oh my gosh, thanks, Claire. That is another fantastic question. Quality of life issues come up quite a bit on the helpline. And again, there's no one right way to engage with this topic, that's for sure. It's highly personal, and it's a very intimate subject for sure. I would agree with the caller that oftentimes doctors feel like they need to be aggressive in their treatments because that's what they were taught to do. That's largely what medical school in traditional training teaches them to do. Fight as much as possible. Extend life as much as possible. They also have a responsibility to address quality of life, which most doctors do. It just may not come across that way, especially when you're sitting in front of them and all they want to talk about is the treatment. Now, some of my doctor friends that might eventually listen to this webinar, I'm sure they'll want to engage with me in a conversation at a later date about this, and I've had many conversations with them about this, but ultimately their profession teaches them to focus on extending life as much as possible with doing as little harm as possible. Now, it's ultimately up to the patient to decide what level of discomfort they're willing to cope with any treatment. I don't know of a cancer treatment that is void of, all side effects. All the treatments I'm aware of will have some level of side effects to them, and some people will get through them and, easy breezy, no problem, hardly lose any hair, not have any fatigue, not have any nausea. But most people choosing a treatment and moving forward will experience some of those side effects. I think the quality of life question also points to at what stage is your cancer? And what is the diagnosis? And how fast growing is the cancer? And is it at a point where it is deemed stage 4, which means it is in multiple organ systems and in multiple locations? That quality of life discussion is going to be very different than a quality of life discussion with maybe someone with stage 1 breast cancer. It doesn't mean that the person with stage 1 breast cancer is not going to think about quality of life, but the context is very different than with someone with advanced stage 3 or stage 4. I think as long as the patient opens up the door to have the conversation with their oncologist and asking questions of, is the cure, so to speak, going to be more harmful to me, or is the treatment going to be more harmful than the actual cancer, is a really good way to sort of get to the meatier part of that discussion. And I think asking doctors about fatigue, about lymphedema, about neuropathy, about depression, about physical limitations. Am I going to have chronic pain and not able to walk anymore? Largely, the patient has to kind of put those things forward and engage in a conversation with their oncologist. Most oncologists will eventually bring it up, but they may do it in a way that they kind of do it at the end of a discussion, and it might be kind of a rather quick note that they make, and because they're really focused on wanting you to think about how the treatment is going to be ultimately better for you, and in most cases it is. But if you have concerns about it, and if that's something that's really important to you, then I would bring that conversation up, because if you're going to wait for most doctors to talk about quality of life with you sort of in a proactive way, you might be waiting too long. And again, that's not, I'm not trying to be overly negative about the medical field, and I would love to hear Carmen's perspective on this, but first and foremost, they talk about treatment, and they talk about trying to eradicate the cancer. And that's where their focus for most people it actually needs to be, but not for all. So that was a great question. Thank you so much. I don't know if I answered it at all, because there's a lot of gray there. It's very, very little black and white in that question. So, Carmen, I'd personally love to hear your perspective on that as well.
Well, thank you, Justin. That was, when I heard the question, the first thing I said was, wow, that's an incredible question to ask. And if I may, just from personal experience, not just with myself, but with working with other cancer patients, the place that you choose to treat, if it's a research center, they're going to take it to the max, because they want to see what this will do and what will bring you down to your knees to eradicate the cancers. And knowing your stage is very important, as Justin said. Stage 1 and 2, very different than stage 3, 4, and 5. Very different. So the aggressiveness may buy you time in the later stages. Will it buy you the most comfort? Depending on what the drugs are and what the treatment is. And I have found that nurses, because they have viewed so many people with so many different types of cancers, and the treatment and the quality can give you a good perspective. For myself, I had to ask what could be adjusted in my treatment when I found that I was running around and people were saying, could you slow down a little bit, because I was speeding because they had put too much of a drug that was a steroid that was overamping me. So I asked the doctor, can we lower that part of it? And he goes, are you sure? Most people want to have energy. I said, I have so much, it's overwhelming to people to even be around me. So he lowered it, and he couldn't believe the difference, that I still had tremendous energy, but I was not on edge. So knowing your own body once you start a treatment, quality of your life. For some people, having extra energy, that enhances their life. For some people, it's too much, and it does not. The aches and pains, I've been with people that say, no, I don't want any more treatment, and I respected that. With myself, when I said time to stop this, it was you have to really check in with yourself, and if you're the caregiver and wanting to know, I had one person say, well, if you get this, it'll extend the life this many months, but if you don't have it, you won't be suffering side effects, and you'll still have months without discomfort. don't know, like Justin had pointed out, it is lots of gray areas, lots of individual unique. We're all unique, and that's the one thing in the medical profession, because right now we have an epidemic of cancer and another condition, diabetes, that they're being overwhelmed with. What do we do? And so each person is unique, so you have to bring that uniqueness to increasing someone's appetite if they like eating and getting them to eat more. And but if they don't want to eat, then maybe that's not the right thing. It is a very personal, and each person has a unique circumstance. And once again, the staging of the illness or the disease is very important. I hope I've helped shed a little bit of light on a very important question, very deep question. And we'd like to hand it back over to Claire or Justin if you have comments.
Thank you, Carmen. This is Claire. We really appreciate your perspective on this. I do just want to clarify that the standard stages for cancer are usually stage 1 through 4.
Yes.
Just clarifying.
Standard, but then you can go into then there's different standards, say stage 2, 2B, 3B, depending on how many nodes. There's little variations, but those are generally the stage. I am in no stage right now because it's too small, so there's the no stage cancer, which I've never heard of before, but now I'm really looking at, wow, this is very interesting from a scientific perspective, from a research perspective. This is before it manifests into anything. So yes, there are stages, but you can catch things before they are at a stage, and sometimes you don't. But yes, that to clarify, I believe that, well, from what I've read and studied, Justin, you may want to add to that. You're very educated in this. Those are the stages that I'm aware of, stage 1 through 4.
No, I completely agree. The typical 4 stages with the A and B sort of subsets within certain stages, absolutely. So, yeah, thanks, Claire and Carmen, for clarifying that.
Mm-hmm.
So before we end tonight, I would first like to ask Carmen and then turn it over to Justin if you have any last thoughts that you want to make sure that our listeners are left with in terms of decision making.
I do have, this might be in reverse order. Hopefully, Carmen, you're okay with this. I am going to mention one thing that I failed to mention earlier about the importance of knowing the type of cancer and the staging. Right now, Cancer Support Community is engaged in a program with the Lung Cancer Alliance to provide transportation grants, which are basically gas cards in the amount of $200 for those with stage 3B lung cancer or higher. It's amazing how many people we have call up and want the gas card, but they're not sure what stage they are, and it's in order to be eligible, you need to have a very specific stage. It can be any type of lung cancer, small cell, non-small cell, doesn't matter, but it has to be stage 3B or higher. So I think for those folks who are looking for financial aid resources, there's a lot of disease-specific funding out there. And so if you know exactly what you've been diagnosed with, you can really hone in on where maybe some of those funds are. Because this one obviously is very, very specific. It's stage 3B or higher, and it's for a $200 gas card. And we do have to say no to quite a few people who are at stage 2 or stage 1. And I most certainly know that they need financial aid, that is for sure. But we have to follow the guidelines of the Lung Cancer Alliance, and that's part of the eligibility. So again, that's just one more example of how knowing your diagnosis and specific staging can be very helpful for you, especially when it even comes to looking for additional resources that might be out there.
Mm-hmm. Yes, excellent.
Great. Well, Carmen?
I was just going to say, yes, the staging is very important, and knowing what type of cancer cell you're working with, so that you can actually understand it better. So you know that it's you are bigger than your cancer cell. One, I really believe it's a very weak cell, and what you can do to assist yourself. But knowing your staging, Justin was very correct. There are many resources out there for people, but at different stages. And what I experienced with the lung cancer was a little bit of, I guess what you call it, stigmatism, in the sense of, I don't know if I'm using the right word, that a lot of the funding that was for lung cancer went over to the breast cancer. A lot of the funds were, they say, now we're not doing lung cancer, we're doing mainly breast cancer, so you're not eligible, blah, 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 and which is fine, because people with all cancers need help. But I just found that lung cancer, the first question they asked you is, were you a smoker? And when I tell them no, they go, well, how did this happen? Then I start educating people on the radon, the ground gases, the toxins in different places, and life happens, and it also can be hereditary. So to wrap this up, what is important is to listen to yourself. You are your own best advocate. To take time to sit down and say, how do I feel? What's out of sync? And to work with the health team, a healthcare support team, and ask the questions. Your body does remember what your mind forgets. So if you keep going back to your body, how do you feel? The answers will come up, and you can write it down or draw a picture and say, show the doctor, this is what it feels like, this is where it is. And don't neglect saying, oh, my grandchildren need taken care of. Oh, somebody needs a ride. Don't not take care of yourself. This is the most important thing, I think. Thank you.
We would like to thank and for contributing their time and sharing this important information with us. CSC would also like to thank our program supporter, Lilly. At this time, we'd like to let you know about our upcoming webinars, Frankly Speaking About Cancer, Coping with Anxiety and Depression, and Frankly Speaking About Lung Cancer, What You Should Know. For more information or to register for a webinar, please visit cancersupportcommunity.org/webinars. If you would like to learn more about lung cancer, immunotherapy, and clinical trials, please visit the Cancer Support Community website. In addition to these sites on specific types of lung cancer, immunotherapy and lung cancer, and clinical trials, to get information about treatment decisions, you can visit www.cancersupportcommunity.org/open2options, and that is open, the number 2, and the word options. And there's a whole web page that talks about treatment decisions, has a fact sheet you can download with many of these questions in it, and has a section you can click on to learn more about the Open to Options program. Thanks again to our panelists and to our program supporter, Lilly. Please take a moment to complete our webinar evaluation survey, which you will be automatically directed to. We greatly appreciate any feedback you may have. Have a good evening, and thank you.